So, hello, Christine.
You might have to edit
Oh
that
my
bit out.
days.
Oh my God, I'm so sorry.
That's all right. Do people do it a lot because it's an unusual name?
Oh, no, it's a lovely name too. I was thinking
Christella.
it'd be a quite popular trans name.
Yeah.
I'll start again.
Welcome to the Joy Tap Club, the podcast that celebrates the beauty and diversity of transgender individuals and identities. I'm Rachel, my pronouns are she, her, and with me is my wife and co-host, the beautiful Phoebe.
Oh, I love your intros. Also, she, her.
What are we doing today, Phoebes?
Today we're just perfecting our pitch, raising our resonance, and improving our intonation as we tackle all things related to gender-affirming voice therapy.
That sounds like something to shout about, but wait, shouldn't this be our Christmas special?
Yeah, but you know what? It feels like it's Christmas here with you every day. For now, we're talking with consultant speech and language therapist Christella Antoni. So maybe it's a Christella-mas special?
Well, after the sleigh crash that was last year's unreleased Christmas episode, perhaps we're better off with the second in our series of interviews with transgender healthcare specialists instead.
Yeah. So last episode, if you recall, we spoke to Dr. Chadwan Aliachi about gender-affirming vocal surgery, and he and Christella actually worked together as well.
Yeah.
Today we're learning about the other option for changing how you sound using voice therapy instead of surgery.
Yeah, and as you mentioned, Christella is a consultant speech and language therapist who specialises in adult speech and communication disorders with expertise in voice. Besides clients like us, she also works with those whose voice is central to their career, for example, media professionals, actors, singers, that sort of thing.
Yeah, I got to say, it was such a fascinating interview. But, you know, one thing that came through Christella clear...
Oh. My God, the puns are falling thick and fast.
Was that there's never just one plan that works for everyone.
Yeah, her approach involves a tailored therapy for each individual client. Unlike some of the voice training tutorials that you see online, ensuring efficient and successful outcomes, she's very experienced and has worked with hundreds of clients, helping them improve and develop their voices to reach their true potential.
Right, and obviously the main reason we asked her on this podcast, besides being a lovely person, is for our series on transgender healthcare, and she has extensive experience in transgender voice therapy. She's a leading clinician in the field, and she does in-person sessions in London, but as she'll also mention, that's by no means a requirement. Online works just as well.
Yeah, so before we play the interview, I thought we could just have a quick discussion about our thoughts on voice therapy and run through some of the things that we covered in the interview.
Oh, yeah. Do you want to start off?
Yeah, I do, actually, yeah.
Please, go ahead.
Yeah, my thoughts. Before this, I was very much in the camp that I was going to have vocal surgery.
Yeah.
I'd seen vocal training online, like YouTube, TikTok. You can't really go on a trans forum without seeing someone talking about voice therapy.
Right, Reddit.
Training, yeah, Reddit. Tried some of them, couldn't really get on with it. Didn't take, so I thought, you know what, that's too much like hard work, I'm going to go for surgery.
Right. Yeah, the same for me. It was this idea that surgery was a shortcut. But even as we learned in the interview with Aliachi, surgery on its own doesn't work. It needs therapy to go hand in hand because they address different aspects of the voice.
Yeah.
Yeah. So when we heard Christella's presentation at the Facial Team Gender Affirming Healthcare Forum, the difference in the before and after clips really hit home. I mean, I couldn't believe it.
No, I remember we heard it and we both just sort of looked at each other, mouthed, oh my God.
Yeah.
But without giving too much away, let's have a quick run through of some of the things we spoke about.
Yeah. So one of the things obviously was the core difference between masculine and feminine sounding voices. And it's not just pitch, it's resonance and intonation. So surgery will impact your pitch for sure by cutting out, in feminization, cutting out the lower registers. But the other parts are up to you. And if you're born cis and you're raised female, then you learn to speak a certain way. And the opposite goes for masculine.
Yeah. Yeah. We also spoke about the challenges. The challenges?
The challenges?
The challenges.
We have lots of challenges.
The challenges that trans people face accessing voice therapy, 'cause it's not cheap. You've got to weigh it up amongst other things.
Yeah.
But I think we decided that, like, for us, or definitely for me, it's something I'm going to prioritise because it's how people perceive me on the phone or in meetings and stuff. So I'm definitely moving this up my agenda after this.
Yeah.
And keeping in mind it's also a time commitment, and it's not a quick fix, maybe like you think surgery is. It takes time, it takes effort. If you're having surgery, you need the therapy as well, preferably beforehand. So the process will take effort no matter which route you take. But with this, the results don't fade away, and it should become second nature. But you'll start to see results as little as after 4 sessions.
Right. Some people get it right away, though, and some don't. And we hear all about that in the interview. I think one of the things that I learned is surgery can be your first point of call, but it also might be best to treat it as the backup plan if therapy doesn't get you where you need to be on your own.
Yeah, and something that we learn in the interview as well is that in the end, if you have a good therapist and they're the right one for you, vocal training should feel natural. It shouldn't feel strained or difficult to use their voice. And I always thought that maybe it was like a put on, like you were mimicking someone. And apparently this is why individualized therapy is so important.
Yeah. One of the things I really enjoyed learning in this as well was how the singing and speaking sections of our brain are different. And this comes out in the therapy. So you might complete your voice therapy and past clients will say, hey, I no longer feel like I can access that lower part of the range anymore. It's somehow been locked off. But they can if they choose when singing.
I know. Apparently it uses different parts of the brain. I can't believe it.
Yeah.
Specifically for UK clients, we had a chat about availability and accessibility of voice therapy services through the NHS and insurance.
And we talked about pricing as well. How much should one budget? And it seemed to be about £1,000 to £1,500 for 6 months of therapy, although obviously the fees vary among therapists.
And as a side note, during the interview, Christella talks about someone with a hoarse voice. And she doesn't mean talking like Mr. Ed, as I first thought. Wilbur, come in the room.
Oh, no. Okay. So, if we're going to do that, let's get on to the main event.
Oh, you want a pun off?
Yeah,
all right.
yeah.
Enough fouling around.
Stop nagging.
Oh, Wilbur, play the harp.
Hello, Christella. Welcome to the Joy Tuck Club. Thank you for joining us.
Hello, Phoebe. Thank you for inviting me.
Hi.
And this is Rachel.
Yeah, I'm here too. Hello.
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 Hello, Rachel. Hello. Nice to see you again.
Could we start with just a basic explanation of what a consultant speech and language therapist does?
Well, I'm a speech and language therapist, a voice specialist. Titles are just given according to processes that you go through when you're training. So I went obviously quite high up when I was in the NHS. And so we were kind of given certain titles because of that. And part of that consultant title was to do with my specialism in trans work, because it was, in those days, much less common to find any voice therapists working in that field. There were just a few dotted around. It's grown a lot now. So it involves voice work, really. You really come to it from a background of voice, although sometimes now people are coming to it more, going into trans voice work a little bit without so much background in voice. I'm a believer in having a big background in voice, because the more voices you hear, the more experience you have working with voice on all types of voice issues. And voices are something that some people want to develop, but sometimes they can also go wrong or not function very well. And I quite like having that full background. So with a background in voice, people often move into trans voice work, which is really like a subspecialism, I suppose. And we just assist people who want to modify their voice so that it aligns better with their identity, And that can be for voice feminization, for masculinization. Some people want to obtain a more neutral type voice. So we don't really prescribe any outcomes for people. It's really client-led, or it should be client-led. And we work with those goals. Sometimes the goals shift a little bit and sometimes they don't. They're very fixed. But the therapist usually does their best to help the client achieve the goals that they're seeking with their voice, and to promote a wide range of voices. So there's not just one fixed type of feminine voice at all, or masculine voice. And we need to work within the framework of that person's vocal tract, but to just, help them to achieve their goals, really.
Okay, so that's kind of the why. Could you delve into a little bit into the how? Could you explain in layman's terms the different ways we can change our voice, like pitch elevation, resonance, intonation?
Yeah, so there tends to be certain things that are targeted quite consistently when people work on their voice. And one of them is the resonance. And the resonance just basically means how your voice vibrates through your whole vocal tract in your body. So like a musical instrument, if you pluck a guitar string, it's not just when the string vibrates, it sets off reverberations around the whole body of the instrument, and different shape instruments reverberate different ways. So narrow instruments tend to produce brighter sounds, and wider and longer instruments tend to produce deeper sounds. So we work with the resonating cavities of the body to try and get people to be in touch with how their voice resonates. And you can feel resonance and you can usually hear it. So if I kind of have more of a chesty voice like this, and lower everything and try to build up my chest resonance, usually that goes well with low pitch. If I try to brighten the pitch and lift the resonance, that will usually go better with higher pitches. So we work with resonance because it's something that can be explained and felt a little bit. Not very well researched because it's really difficult to research resonance. However, it's an experiential thing that tends to make a lot of difference to people. The other thing that's frequently targeted is pitch, and therapists do this to varying degrees. So some people are more comfortable working with pitch. I'm very comfortable working with pitch, and I think it can be modified very successfully because I have thousands of cases of that being done successfully. But I know other therapists are more wary of it because they worry that it might strain a voice. But it's really in the way that you do the resonance and change the resonance. So we need to, the pitch, we need to do that without strain, and you can kind of pull a pitch up and do this kind of thing. And actually, unfortunately, there are many interviews and clips on YouTube that kind of advocate that kind of thing. And that's a bit of a problem because often when people come to us, they've tried certain things like that and have got locked into some quite strained ways of talking. So pitch is not everything, but if people want to have a female perceived voice at the end of treatment, say they're trans feminine clients, then pitch is something that will need to be targeted usually to a certain extent, just to get it to a level where there's a crossover of pitches. There's a kind of gender neutral range, there's a male range, and there's usually above a certain pitch, which is about 160 hertz, the voice starts to be perceived as more female. And there is quite clear evidence for pitch. It's something that you can measure in hertz and semitones. So that's a lot of the research was done around pitch especially in trans feminine voice. But there are other things as well, learning to use the voice, move the pitch up and down, which is called intonation. Again, it's much more prevalent in female voice. So that's often targeted and something that can be, started a bit more gently for someone just wants a bit of movement. There are other things, the way the speech is delivered, the vowel length, for example. If I get very clipped and short like this, it tends to move more towards a masculine sounding voice. So every voice is different. So somebody might not need that at all. So that's why it's very difficult to prescribe. And that's why good therapy should be individualized, really, according to that person's voice and that person's goals.
Thank you. You would work on sort of a combination of all those things with the client.
Yeah, my method is to integrate those very quickly. I think I don't just do a breathing 1 week and then intonation 1 week and then it really, the exercises are introduced and then they're integrated quite quickly. In reality, it's quite hard to work on pitch without involving resonance, really. And so if you're going to change the pitch, usually I build in the intonation quite quickly into that work as well. So if you're saying the word or the phrase any day, you could just do it on a higher pitch, any day. But actually, it actually sounds always better if there's some movement attached to that, any day. So it has a little bit of movement attached to it. And actually, you wouldn't think it, but more intonation often, especially in female voice, makes the voice sound more natural. if the voice is a bit flatter and a bit robotic, that tends to take away from the feminine perception of a voice.
So you learn to control all these different aspects. I loved your analogy, speaking of instruments.
Yes.
And the similarities there. When you see a client, and do you sometimes in your mind's eye think of them as, oh, this is a double bass over here, and this is a piccolo, and oh, this poor person's a kazoo. What am I going to do with that?
No, that's never come to my mind actually, but you do naturally can place somebody's register. So if somebody, the first you take the baseline measurement, you'll know that voice is like a bass. You think of it more in the registers, a bass, a baritone and a tenor. So higher cis males have got higher voices, usually a tenor kind of speakers and singers. If the voice is very low, tends to, so you think of it a bit like that. And in females too, there are people who are naturally soprano when they talk, let's say, where they're just high-pitched speakers, and people who are more mezzo and alto. So you think of it a little bit like that. But actually, sometimes if someone's a very bass speaker, if their pitch is very low, like 80 hertz or something, you know that person may be a bit limited with what they will achieve post. But you can still normally get somebody to a gender neutral and just above if that's what they're going for, if they're a trans feminine client. But there might not be somebody who'd be able to get much above, let's say, 160, 170, just because the starting point is so much lower. So I think of people more in registers rather than instruments, really. And sometimes there's no bearing on it. Maybe. For example, somebody might start off low and then they might be able to do amazing things with their voice. So again, people's ability varies as well, and their ability to be flexible. But if it's there and the goal is to get a higher pitch, we will work to develop it.
Can this voice training help anyone? Do you work with other types of clients? For example, someone wanting to improve their voice for media?
Yes, I'm someone unusual in a way because I work with all voice, and throughout my career I've maintained that. Now I could have done 150, 200% worth of trans voice because I had so much work come my way, especially the early days. There were not many specialists, and I was very well known for that because I really felt it was something that needed to be put on the map more. So I did a lot of work in training other therapists so more people could do it because, clearly it couldn't all go to one or two people. So now many more therapists do it, and I could have gone down that route. But for me, the whole of voice is very important. And I had quite a big career in voice disorder work, and I still do. So now I try to keep it around 50-50 of trans work and then 50% other stuff because I have a team and I can delegate lots of the work to them. And, I train them all in the same feminization, masculinization, all these different programs I have, so I can ensure the quality of the work. And I work a lot with performance voice. So, I really like working with singing voice. I work sometimes with actors who want to develop voices, performers who have, who need to, be able to project voice or have an injury with their voice and need to rehabilitate that. So voice rehabilitation is a very big part of my work still. And I will always keep it so because sometimes the worlds collide where you'll get a trans individual who also has a voice problem. Sometimes voices go wrong for everybody. So if you don't have the background in helping voices rehabilitate, so you've got to manage that side of the work plus the voice development. So for me, having this wide encompassing view of voice and ability to work with voice on a lot of different levels is really important to me because I'm kind of very hybrid, I think, in the way I work. But also, I think it's a benefit to the client because somebody can kind of work with the whole person and the whole instrument.
Do you think you've seen a rise in transgender clients, or?
Yes, I mean it just completely. Just if you think about how many more therapists are doing it now as well, and lots of them are really busy. So it's just been a growing year upon year, I would say. Just in the same way that the gender clinics got busier and busier in the last, the problem with that, however, for speech therapy is that the waits in some NHS services are up to about 4 years for speech therapy, and that's just means that people don't access it just because the wait's too long. And then we have the issue of sessions being limited again in the NHS, and really most people need a good amount of sessions to really kind of help them get the voice they want. It's not a quick thing. It's not a thing where you're just trying to control your voice and you stay in this constant mode of having to control and sustain your voice. Good voice therapy means the voice evolves so that the voice changes into that and it becomes second nature. That's an effective outcome. People often think it's like putting on a voice or impersonating a voice. So there's so many myths about voice therapy that actually work against it, and actually make people not try sometimes. So there are a few barriers to accessing it, which is always been at the back of my mind, trying and change that by training more therapists and developing an app, for example, that somebody could access something wherever they are in the world.
So voice therapy is available through the NHS? It's
available through the NHS, yes. If you're under a gender clinic, yeah. So, for example, my background is predominantly NHS, I suppose. I was but I always combined it with private work because I always had demand. So I always worked part-time in the NHS, sometimes up to 4 days, sometimes 3 days, sometimes 2 days, but I always had a balance. So for about 15 years, I was the lead clinician at the Gender Identity Clinic in London, the big one, and so ran that, and that was a voice post solely devoted to trans voice. And then down the road at Charing Cross Hospital, I did a voice job that was voice disorders. So it was brilliant to have two centres. In those days, they were very close together, different trusts, but doing both aspects of my work. And so there are other gender clinics. Most of them will have a speech therapist aligned to them. Some will have a little team of therapists aligned to them. So when you see the site for assessment, they often will ask you about voice, but if they haven't, then you can ask and say, I would really like to work on my voice. Could I be referred? We now have the change where people can choose the gender clinic that they see in the NHS. They can choose where they go. But unfortunately, that doesn't correlate to speech therapy. You have to see somebody local to where you are, or someone under that gender clinic. Yeah.
If I ever get to see a gender identity clinic, I'll be sure to ask.
Well, therein lies the problem. Getting to a gender clinic is a problem. So I just think the barriers to voice therapy in the NHS now, for trans people are really high. But at least if they know what they're entitled to, some services will be lower. Sometimes these new services spring up, so that sometimes shortens the list. And also they're trying to devolve some of it, more locally, the gender care, aren't they, to GPs and things. So that might mean quicker access in the future. But
so on the NHS, your service is only accessible through the identity clinics. You can't just rock up to it and get it done on the NHS without going through.
No, so in the NHS, they require you to have a confirmed diagnosis of gender dysphoria because it's all centrally funded through NHS England. So to release that funding package, which will include speech therapy if the person wants it, and certain things like hair removal, there's certain things they approve. And certain things they don't. So that voice surgery, for example, isn't included in that. It used to be in the old days when I was, the gender clinic. That's why I gained a lot of experience with voice surgery, because I was there when they were doing it. But now I work closely with a surgeon who does it privately as well. So managed to keep up those skills and evolve programs around pre and post surgery. But a lot of people, I think, are having surgery because they can't access voice therapy, or they're not sure what it can do for them. They don't really have a clear understanding. So I always say yes to trying to promote what voice therapy can do. And it's not just about changing the voice. Of course, that's hugely important. But it's the fact that when you're able to modify your voice or align it better with yourself or have more confidence with your voice, whatever it is, people just tend to socially function better. Because a more confident person, a person who's not scared to talk or go out more, or not worried about people wondering about their voice, that just hugely tends to free up a person immensely.
Yeah, we really understand that issue.
Yeah. I mean, I've lived it so many years with people, so many years. I've had people who say I haven't talked for 18 months in public, or I won't go out. And that really bugs me. Part of the speech therapist's job is to assist people's communication. That's really why we go into the profession. And we work with a range of voice and communication difficulties. So for me, having a voice that people are confident to use just really fulfills even my purpose, which is to assist people to feel comfortable to communicate, or communicate the best way they can.
So how do you manage a patient's expectations when they come to you? For example, you've heard me talking for a little bit now. Do you instantly diagnose someone and say, oh, I know what they need to do? And how do you arrive at, I want to know how much it will cost.
Yeah.
Can you give any estimates? And what do you do when someone's got a very masculine voice? You just kind of go, look, you better go have surgery first and see me after, or?
I never really judge a voice or that they need this or that. I'm more likely to think if somebody's dysphonic. So dysphonic is the kind of formal term for when someone has a hoarse voice. So the pitch of someone's voice or how the voice is coming across doesn't really bother me too at all, unless it's a problem for the client. It's only when it's a problem for the client. But if they're dysphonic, if they have a hoarse voice, then I do sometimes feel conflicted about whether to well, this is just somebody I might come across in general public. If someone's come to see me, of course, they know that there's a hoarse voice. They've usually seen an ear, nose and throat doctor. But if you hear a hoarse voice, it's something that always will trigger a voice therapist's ear, because hoarse voice can be just a bit of laryngitis. It can be just a pattern the person's developed, what we call muscle tension dysphonia. People learn to strain their voice, or they have nodules. There's so many things that can cause a voice to sound hoarse. But it also could be a sign that there's something more serious going on. For example, cancer will present often on the vocal cords, will present as a hoarse voice. So we always make sure if we're seeing a voice client, not a trans voice client, but just a general voice client, that they've seen an ENT first. And similarly, if I get a trans client who sounds hoarse when they come, and I will then say, you need to see an ENT because you have hoarse voice, and we need to see why that is. Very often it's something like a muscle tension dysphonia, but we always need to rule out anything else and any pathology on the vocal cords, first of all. So vocal health is always at the front of our minds. So I only work with the clients who want to work with their voice, I suppose. So I don't really judge, because some people are very happy and they don't want to work on their voice. So why would I say, oh, you can sound like this? It just doesn't. But if they say, I really want to work on it, then you need a certain amount of motivation to work with an individual with voice. It's not a passive thing. They have to actively be involved in it. So yeah, you need a motivated person, and it's a commitment. It's a time outlay. It's a very rewarding thing to do voice work, because if it goes well for the person, they get so much out of it. That's a lifelong thing. Being able to communicate more comfortably, to me, is a lifelong reward. Whereas going to the gym or losing weight is a good reward when you achieve it, but it can be temporary if you don't maintain it all the time. The brilliant thing about voice therapy is if it's done well, once the voice is modified, developed into something the person's happy with and comfortable with, it should stick for life. It's not something you have to keep paying for, like gym or membership And so in that way, I think it's very good value for money. On the other hand, it's very specialist. It takes a lot of therapist skill and time. Like all voice therapy, if they're not people who are going privately will need to pay for it, unless they are covered on their insurance policies, which increasingly they are, which is great. So as a rough guide, you need to set aside, say, about 6 months, I say. Someone was being seen every 2 weeks for 12 sessions. And fees for therapists vary. So in my practice, for example, my fees are a little bit higher than the associates, because I wanted to offer something that people could access, a lot of people could access the same kind of quality for a bit less. So I think people would need to budget between about 1,000 to 1,500, and there'll probably be therapists in other places where it would be cheaper, maybe just, under 1,000, or if they just did a few sessions. But I think if you're going to go for it, thinking of it like over 6 months and say about £1,000, let's just put a round figure on it, is realistic.
Right.
And in comparison, I suppose voice surgery is more like about 5 or 6 or something like that. So that puts it a little bit into perspective. But there's another aspect of voice therapy that people don't often consider. I know that ENT specialists, very much agree with this, is that when you're doing voice therapy, you're walking a dual role with somebody. You're walking a kind of a voice exercise road, but you're also walking that dual road of counselling support, because working on your voice brings up all sorts of things, and it makes people self-conscious, and people worry, well, how am I going to? So you have to offer all that counselling support along the way to help everything just evolve and stick in the long run. And in that way, I think people find it a really supportive process, because we get to know our clients so well, because they may only see a sight person a couple of times a year. Okay, they might see a hair removal person a lot of times, but I think that you work with somebody very holistically in voice disorders and voice generally. So we have that background. So with trans voice, we're very used to doing that kind of counselling supportive role. And I think people really value that. When we get feedback, that's one of the things people often cite as hugely beneficial, because most of us have been around a long time, know different services, we know different people in the field, and we can often help somebody access something or think about going to somebody or recommend somebody just because we have that kind of knowledge in the field.
So if I was coming to a consult with you for the first time, how long are your consults, and typically what would I expect to happen? If I'm walking into your office, or I don't know, can you do them over Zoom as well?
Yeah, so it's a good thing to be aware of that, predominantly now, let's say about 65% of my work is now online. And that's not because I insisted on that, but because really clients prefer it. And 2 days a week, I go and see people in person. For the people who prefer, there'll always be people who prefer face-to-face, and there'll always be people who prefer online. And there'll be some people who prefer a hybrid, which, maybe have the first one or, in person and then online and then maybe the odd one. So you can mix and match. There's no right way. And I'm a big believer that in online therapy, because it works so well for any kind of voice work, really, which people, not all voice therapists would agree with me, but for me, predominantly, as long as I can see the head and the neck, I'm fine with that. And if they can see my head and neck, that's fine. There are some therapists who work a lot more with the body, that might get, want to see the whole body. But for me, and I've worked really successfully without doing too much body work. I mean, you can kind of, work on tension in the upper body anyway online, but it's really about them being able to hear you and you being able to hear them. So there are people, hundreds of people whose voices have been modified online that I've not met in person. So I absolutely can attest to the fact that it's successful. And I had experience of it even before COVID, because when you're very specialist, you get people coming from all around the country to see you. So there was always a lot of pressure with the role, actually, in the early days, because people would book flights from Ireland or Scotland or Manchester. And sometimes, if you're not feeling that well and that people have booked flights in these trains, that there's always this pressure to just be there. So, which I try to do on every occasion. And I was used to some people saying, well, can we try one by Skype? And then when we tried them by Skype, well, you start to realize this works really well. So some people then would do a hybrid, even pre-COVID days. So I suppose I had that insight that I know that it works. So you would, in answer to your other question about what you expect, well, you turn up either online or in person. And I'll take a bit of a case history, just a bit of a background to where they are and things, not in too much depth, not as much as I would with a standard voice client who had, like, say, nodules and wanted to, because then you're in a much more of a medical program and you'll need to find out about medications and things like reflux and, those kind of onset of the problem, those kind of things. But with the translator, just to know roughly where they are, where they're sitting, what they think about their voice, what their voice goals are. So a little bit of history, and then an explanation, an outline of the process, that there's kind of a beginning, a middle and an end stage to it, a 3-stage process, the way I do it. Expect to have a voice recording made that usually the client does themselves and sends to us, so it's not too stressful, and they don't even have to listen to it. But we do that really because a good voice assessment should always have a subjective measurement, a perceptual measurement, which is the therapist listening with her ear or their ear, and then what we call an objective measurement. And the thing that we can objectively measure with voice is pitch. So we take a measurement of pitch, and then we just kind of park that. That was where the speaking voice started at. And as well, in my sessions, I try to make them very good value for money, because I always start the therapy in the first session. Some people prefer to just do an assessment, we'll start next time. But I think often people have waited a long time. It's a bit of a costly thing, really. So I make sure that we start session 1 exercises in session 1, and they have something to take away in practice to session 2. So it's about three levels of some history, recording, and some treatment.
That's very interesting with the recording. For example, just to turn it around a bit, would someone come to you with a recording and say, I don't know, this is Beyonce, I want to sound like her? and
not
how do you address that?
Not so much, thankfully. I once had an impressionist ask me if I could help her sound like Beyonce for an impression she needed to do, and I said that is a really, really big ask. That was a big ask. However, some people sometimes have fixed views about people they like the sound of. That's normal. We all kind of lean to certain voices. Now, so I like this person's voice or that person's voice. It can be a little bit helpful, but as much as possible, the voice modification needs to be within the own person's vocal tract. So, for example, some people have higher held larynxes, lower, wider, narrower. And if somebody wants to sound like somebody who you know that vocal tract is completely different to theirs, you know that's not going to work. And when we're trying to sound like other people, we really are going into that kind of more impersonation mode, which I don't mind doing that if it's an actor that needs to develop a voice for a role. I've done a lot of that in my career, and I really enjoy it. But I wouldn't advocate that for people who want to modify their voice to sound more feminine or masculine or neutral. It needs to be a version of their own voice, but not somebody else's voice.
Okay, so is it like, for example, with the FFS, a facial team's approach is to essentially remove the additional bone that was placed there by testosterone. And then, there are other necessities as well caused by testosterone, but it's about essentially stripping away to leave what you are behind. With changes to the voice, does any of that apply, or is it more like creating something anew?
I guess a little bit of an analogy you could find, because like they're stripping away the things that are extra unneeded, in a way, to feminize. We're doing the same in that we're taking away the lower range of the voice. Let's say it's a trans feminine client, we'll be taking away the lower range of the voice in a way. And some people often say, I can't do my low voice anymore. And it's so interesting how the mind maps onto a different pitch range, because technically, if you haven't had surgery, you haven't altered the vocal cords or the vocal tract, but they'll say, first of all, I find it really hard to do my voice. And then many people say, I just can't do it. It's just really, I'd have to really think. And that's where you want somebody to get really, where they're not, the old voice is actually just kind of moved away, not surgically, but it's kind of dissipated away. And so it's just been transposed to a bit like how you transpose a song to a different key, you can transpose them higher or lower. So that's what happens really with voice therapy, that their mind maps onto a different way of speaking, and then it kind of assimilates it. Yeah. Sometimes it would be stripping away, but sometimes it would be adding. For example, if somebody uses a very narrow pitch range, very, very kind of narrow, you would be adding pitch range. So I suppose, unlike the surgeons, we add things. But then again, sometimes I suppose they do add if they're adding, say, cheek implants or something.
Yeah.
So it's a combination. So it's quite a good analogy, I think.
So you work with trans femme and trans masc patients. Which one would you say is easier to achieve their results that they want?
Well, it's an interesting thing, because with the trans masculine clients, of course, a lot of them take testosterone, which lowers the voice. So you can get some that don't have that, and they just want to do it naturally, or some people who want to delay it, or some people who are on testosterone, it hasn't made their voice exactly as they would like it. And that's actually an area where the voice disorders background is really useful, because a lot of people get quite dysphonic with the testosterone. They get like quite creaky, or it doesn't really voice feels a bit strained and it doesn't really move like that. So that knowing how to work through that is very important. So technically you would think with the testosterone that it would be easier because they're given something to assist. But actually I think the level of satisfaction can be a bit harder when it's quite a nuanced issue, and they want it a little bit deeper or a little bit, or they'll have things that are quite post-T. It's difficult, for example, with singing voice sometimes. So then you're working with singing voice. And again, that's why I think I prefer having a background working with singers as well, because some trans people, of course, want to work on their singing voice. It's another aspect. So in that way, it can take quite a long time because it's quite nuanced and quite specific. And so the client satisfaction with that can be different levels. With trans feminine voice, it's actually a much more structured process, because you're often starting at the start and just going through a process. And once they've gone through their course, often that's it. Thank you very much. Feel happy with the voice. So technically, it should be shorter with trans masculine, especially if they're on T, but not always.
Right.
Yeah.
So testosterone affects the vocal cords, but estrogen doesn't. Although I have heard that some trans women say that they have experienced voice changes. Do you think that's because they're probably subconsciously trying to raise their voice?
I think it's got to be something like that, because we don't have the evidence to show that estrogen just change anything. So, I think probably just people evolve a little bit naturally. Like when I first meet a client, I'll say to them, have you made any modifications to your voice? And very often they say, no, or very often I think there's something that has changed with this voice, or they'll say, I think it's changed a little bit, but that's as far as I can do it by myself. So there is something, I think, when you start hormone therapy, it's such a relief for a lot of people that I think there must be some subconscious changes that would happen anyway, even just by the social transition, I would say, actually. Just little changes that people do. And who knows, there might be these micro influences that the estrogen has. But, in cis females, often estrogen it tends to add a little bit of volume to the vocal cords in certain periods of their cycle. So I'm not sure how it would reduce anything. You find opera singers who won't sing at certain points because their vocal cords might be just a little bit heavier than other times, a little bit more edematous, a little bit more fluid in them. Now, this will be tiny amounts because vocal cords are tiny anyway. But, I suppose we just don't know exactly 100% what effect those hormones have on each individual person.
Well, I feel like my voice has changed. I'm not sure it's got any more feminine, but it definitely doesn't sound like it did before I started transitioning.
Well, there you go. And I think it has to be the social transition and the fact that you feel a bit different, you look a bit different. So it just makes people, I suppose, subconsciously lighten something or change something a little bit. Yeah.
Yes, interesting.
Yeah. And so they'll say, I'm sure it's the hormones, but I think it might be more the social stuff.
Now, even though you advise against someone following a YouTube course as the answer, because the therapy needs to be personalized to work on different aspects, I guess it's a unique recipe for everyone. But there are some guides that suggest that trans women try to internalize the sounds and speech patterns of someone's voice they admire. So they're not exactly imitating. But is that helpful?
Well, I guess you could try. I mean, I don't rule out anything really, but the problem is sometimes when you're doing things through YouTube, often the people aren't trained in voice. So, there's somebody who's learned to change their voice themselves, and what would work for that person might not work for the other person. And I know I always seem to receive a lot of people who are totally demoralized after trying those things because they think they're failing. They think it doesn't work because I think they get the impression that they should try these things and it's like a few tips for your voice. People say, can you give me a tip for my voice? And it's really hard to give somebody a tip because to make something stick, you have to actually do it a certain amount of time, even if it's just in the therapy sessions and you're not practicing much outside, like a driving lesson. Usually the person will learn to drive just by doing that process. But so they could just, I'm going to internalize this voice. This person has told me to do this and feel this. And they're trying it. And then if it worked for them because they had a good ear and they somehow just connected to it, of course, I would say that worked for you. And I've also had people who have managed to successfully self-modify their voice completely. So like I said, some people will manage that, but a lot of people that will be too difficult and they will feel they're failing or they can't do it. So I would say if you've tried things like that, don't think that you're not good at it or you can't do it or you don't need to be a good singer to be able to change your spoken voice. It's another myth I like to dispel. It's actually speaking and singing a very different thing. So you can just work on spoken voice to change it. So I would say try things and something might connect with you. And if it does, all to the good. If it doesn't, don't worry about it. There's 1,000 ways to skin a cat in voice therapy and someone will find a technique that works better for you.
I think you've kind of half answered the next question because we spoke to one trans woman recently who said that she gave up on vocal training because it became too exhausting for her to maintain that during conversations.
Yes.
How long on average would you say it takes for vocal training to stick and become second nature, or does it vary greatly between people?
It does vary, but I have a course that's, say, 12 sessions for trans feminine voice and about 6 to 8 for trans masculine voice. That seems to be a kind of an amount that works for most people. Now, most people get the biggest voice change by session 4 in terms of the pitch. And then the next stage is just getting the stamina so that it kind of, what we call, carries over into their real voice. And then the last stage is doing things like voice projection and when you can't see a person, like telephone voice and all sorts of things, presentation voice. So some people go beyond the 12, of course, but some people, I had clients who've done it in 3 or 4, who've just taken to it and it seems to click into something and they never look back. Now, sometimes they're quite young and I suppose quite determined and they're just maybe go-getterish or they just have an affinity with voice work, but very often they're not musicians, they're not trained voice people. They just didn't realise it would be so easy. Some people just find it easy. Just like some people pass the driving test in about four sessions or something, and some people it just takes longer because they're just more anxiety, they're just more scared. So fear and anxiety are very big parts of voice work, and skilled clinicians sit with the client and manage that along the way. And if it feels like you're kind of having to strain your voice and keep it there, it hasn't been the right approach for you. Like I say, it shouldn't feel like you're putting it on your whole life. That to me is not a successful outcome.
No. It should feel natural.
It should feel like it's just evolved into that. And like you lose weight and you don't really realise it. You think you're not losing weight. And then one day someone sees you and says, oh, you look a lot thinner. And you've known that you've been working on it, but it's not immediately obvious. And people need a little bit of patience in the first stage just to get to beyond that first stage where it feels like it's unnatural and it feels like it's not doing anything. And then often when you play them the second recording, they're just blown away by the change. They haven't even been, they think they're not doing well at all. And then when they get that insight, oh, actually, I think I could do this, that usually helps them decide to just carry on and see it through. But if they don't get that response, they often lose hope,
That's so interesting. So you said earlier that, well, voice is different to singing. You might think
voice,
you can't speaking voice. Sorry,
yeah.
yes. So if someone does voice training and it's successful and they get to the point where they say what some of your clients have said, which is, I can't even do that other voice anymore, the lower register. If they're in singing mode, is that register open to them?
If they're in singing, so I personally feel if you first work on changing the speaking voice, it becomes easier to then work on developing your singing voice. So really, most people say, well, I can't get so high, and I'd like to get high. If they say they're trans feminine client, they usually want to expand their range so they can reach higher ranges. Well, I find that once the person has changed their spoken voice, it becomes easier to access that. And we have a course that's about developing singing voice anyway, which helps people develop their voice and get these different ranges. And similarly with trans-masculine clients, it's often, again, with them about extending the range because they'll lose certain ranges and they'll want to develop others. So, obviously speaking and singing both involve the voice, but they use them differently. In fact, they're controlled by different sides of the brain even. So that's why you don't particularly need to be good at singing or have a musical ear to change your spoken voice. However, of course, they're still involved the vocal track. So you can develop somebody's singing voice just as much as you can develop their speaking voice.
Right. So you could subconsciously lose part of your range speaking.
Yes, yes.
But you could still access it when singing. So
you can.
Maybe I could end up with a 4-octave range, for example.
You could, but some people, again, most people would want to maybe sing things in the say they're trans feminine, they want to sing things more in female range keys. But I have had singers who said, I don't want to lose that. But, so it's very specific in terms of I've had to counsel people who want to have voice surgery, for example, who are singers. That really is a worry in a way because they just have to be very informed about the choice they're making. And I think, ENTs do let them know that it can definitely chop off bits of the range, not only the lower bit, but the higher bit when you do a surgery. It kind of transposes the whole average up, but not sometimes will chop off the ends. Not always. Some people can go a lot higher post-surgery. So again, it's you can't predict the outcome exactly. So they have to be prepared, especially if they're going to have trans feminine voice surgery, that they're going to lose the lower range. That's usually a given. So I suppose the advantage of voice therapy is that technically you don't exactly lose it. And if you're a singer, you could still access lower ranges. But sometimes people say, no, I only want to sing in kind of female registers anyway. So it's quite individual.
So if you have vocal surgery, you have to have some therapy alongside that. Can you achieve exactly the results you want through therapy alone?
Yeah. Predominantly, the majority of people that I see are still just voice therapy alone. And it's been like that for me for 20 odd years. So, because there was voice surgery before, but it was a little bit more hit and miss. And even now, surgeons will be the first to say, you'll get some clients where they just don't respond well to the surgery. They've had the surgery, it hasn't changed their voice much. Now, I personally feel that often happens in cases where the person didn't have enough voice therapy before. And I remember I've so many conversations where I've said to people, I think a little bit of work before, but, they've had this fixed view, they're going to do the surgery and then they'll see. And then if it's not enough, then they'll have therapy. I prefer it the other way around because it just seems to work better. So at any one time, I'll have a couple of people who had the surgery and it didn't bring enough of a change for them, and they're working now on the voice feminization. But if you're in doubt, trying voice therapy can be the only thing that you need. You might not need to progress anywhere else. In fact, for many, many years, that's all we did. So, but when people do have voice surgery, we say afterwards we'll do some voice rehab, because like any surgery to remove a polyp or a granuloma, there's lots of things that can be in vocal cords that we don't need, so we have to surgically remove them. All those people will need a course of voice rehab to settle the voice down, post-surgery treatment. And that's the same for when people have, say, voice feminization or voice masculinization, voice surgery, they'll need some voice rehab. And after that, because the voice has changed quite a lot, the shape of the vocal cords has changed, and very often they will need voice therapy to develop that voice, if they want to be able to get louder, just to get used to using that instrument. So many people will choose to have a little bit more. Some people won't. Some people won't even turn up for the voice rehab. And then maybe it will turn up later with, I'm a bit hoarse, like maybe a few months later, or maybe not at all. So you can only advise people on what would help them the most, and it's up to people to take that advice or not.
And one of the downsides of vocal surgery is it can reduce the pressure, so your voice isn't as loud. Are you able to bring that back with therapy, or is that kind of gone forever? I think you can bring it back to a large extent.
So one of the known trade-offs of having voice surgery is that it will lose vocal power, so that often that's voice projection. And the other trade-off is that it causes a dysphonia, so it causes hoarse voice to varying degrees, to varying amount of times in certain people. So some people always stay a little bit rough afterwards. Some people are quite hoarse. So, of course, our job is to try and eliminate as much of that dysphonia as we can post-surgically. And then just to try and, by a sense of training and safe exercises, you just develop somebody's voice to be able to project and not lose too much power, really. So, again, the research on that is quite limited, because the voice surgery to this extent is quite a new phenomena, people doing it. Nearly all the findings are that people find benefit from having voice therapy after surgery and before.
So is there a period during voice therapy, like in surgery, where you have the hoarseness afterwards? Once you start voice therapy, do you need to start using your voice every day? You need to have a period of voice rest after that surgery, at least a week, where you're not saying anything, and that's actually one of the biggest challenges for people. There are other centres where they ask for longer periods of voice rest. In the UK, the surgeon I work, we don't, because there's not really any evidence about that, really. But after about a week, you're meant to build up very, very small amounts, a few minutes, then a few more minutes over the next week. And then about 10 days, 2 weeks after, you should have your first voice rehab session. I see. And let's say I haven't had surgery, I'm just doing therapy. Is there an uncomfortable period after starting therapy where no aspect of a new voice has really kicked in, but do I need to use it every day in public?
No,
is it embarrassing?
No. In fact, I say to people, don't really expect that you can use it in public in the first 4 sessions or so. Sometimes even up to the first 6 sessions or so. It also depends on the level of social transition someone comes at, or whether they're more fluid in their presentation. All these things influence the voice. But we say to people, just get comfortable doing it with the therapist and by yourself or with your partner or something. And then by about session 4, when they hear that they are physically able of changing it, that's when they get a bit of confidence. And I say, just try it with a stranger, maybe try it in a supermarket. Say, thank you, how much is that? Or where's that? Just sometimes trying it with somebody where you don't have any kind of connection with is a lot easier. But you can't just get reasonably good at something in therapy and then just immediately go outside and do it, because voice is a social thing. So your mood, the person you're talking to, and it's an environmental thing if you're in a very noisy place. So it takes levels of voice change. So that's why we leave voice projection to a bit later, when the actual voice is more established. So using it with your therapist, we just say, do the practice. Don't worry too much about how it's going to come outside, because about halfway through the sessions, that's when people start realizing, I did do it a little bit outside, and the world didn't end at all, and actually it wasn't a big deal. And so you have to experience that, and that's the one thing I can't do for people, is be with every single person the first time they start using their voice. But it's really important that at some point they get the kind of oomph to just have a go, because having a go, without the therapist, is usually when they start realizing, oh yeah, I think I can control this car, a bit by myself. Don't need the dual pedals all the time.
Well, I decided that I'm not a candidate for vocal surgery, but you've definitely sold me on maybe trying some therapy.
Oh, absolutely, yeah.
And if I did, how long is the waiting list, and how do we actually arrange a consult?
Well, the good thing about me taking on more people was I didn't really want to have big waiting lists, because that's what trans people encounter every single place they go. So I took on lots of different people who work, like say maybe 1 day a week for me. So it means more people are trained, and we can cover nearly all days of the week. So, you can just fit in with people, and we do evenings and weekends. So we try to make it as accessible as possible. Mm-hmm. So the waiting list is not too much at all. You might only have to wait now 2 weeks. If it was just me by myself, I reckon I'd be booking away into next year. But luckily, I didn't want that kind of pressure. So, between 2 or 3 weeks, I should think you could get an appointment. And sometimes there's always people who can't make an appointment, so cancellations comes up. That's the good thing about having more therapists doing it as well. Was the other question?
How would one go about arranging a consult?
So through the website, christellaantoni.co.uk, that you can do it that way, but you can just send an email as well, and that's on the website. And then we do packages as well. So the first one always paid for just by itself, because you don't know whether that person has to get an idea of whether they want to continue. I don't want to rope somebody into a package when, how do you know? So you have a session, that one's just standalone. We start the therapy, so they'll get something out of that session anyway in terms of treatment. And then you can book in blocks of 3 or 6, which reduces the fee a little bit, if you do it in a course like that. I'm yet to do a kind of a whole 12, course, but I think I might do that and then have another lower fee for that. But some people just like to pay for things all up front. So always
sounds perfect.
Yeah. Try to make it and also if you're students, there's a 10% reduction as well. So just talk to us if you want to access therapy, because at least we can guide you somewhere if it's not with us,
The 2 week wait sounds really good. That's the blink of an eye for a trans person.
I know. I just thought it can't bear all this waiting. So we've got because there's 5 other therapists now doing it. Some work weekends. Some people that will start early. Some people do. It's really how the health service should run. Is people should be covering more days. There's enough people to cover more days and different hours, but sometimes voice therapy is very much still office hours in the NHS, like most doctors' things. And I think we should broaden out more. I think GP practices should offer Saturday appointments and things like that, just to fit in more with modern society. Privately, that's the only time I could have done. When I was working in the NHS, I could only work Saturdays, so I'm very used to that, and I still do it now. So, and that just means you can capture people. If you're very restrictive with your hours, of course your waiting list grows. People will say, well, I've got a 12-month waiting list, but actually they only work 1 day a week or something. So, and they're not really seeing that many people. It just makes them sound like they're really busy. So I say, well, actually, we've got 6 people. There's 6 of us doing it now. So our waiting list is not so bad.
Yeah.
Yeah, and we cover lots of hours. So, that really helps people just get their treatment.
Well, Christella, even so, I think we better let you get back to it.
I know. I've got to get back to it, hadn't I?
Thank you so much for joining us. You've elevated our spirits, and I hope will soon elevate our voices.
Anything that you need vocally, we're here.
Thank you so much.
So nice to meet you both and talk to you again. So, bye.
Bye.
Thank you.
Thank you.
And that was another great interview, full of really useful information. And this one really surprised me with how much I learned, and without sounding too much like Victor Khayyam. Good reference for you there, kids. I liked it so much, I booked a consultation.
Oh, just to elaborate, so you didn't buy the company, but yeah, it did absolutely change both our minds on voice therapy. And if you've been practicing as you go and it's left you feeling a little hoarse...
like stroking a Shetland pony.
We need to stop doing this. You can find a link to Christella's website in the episode info where you can contact her for a consultation.
Like I did. And on a quick little addition to that.
Yeah.
If you sign up to her website, you will get a code for 10% off your initial consult.
Oh, great.
Yeah.
Yeah. And that can be in person in London if you really need to, but like she stressed, online works perfectly well.
Yeah. I booked it online and it 4-week wait for that consult.
Yeah.
So, yeah.
Yeah. Well, I'm really excited for you. I can't wait to hear how this all turns out. So let's wrap it up, shall we?
Let's.
Okay. Thank you, listeners of the Joy Tuck Club, for tuning in and being part of this community. If you want to connect with us further, please visit our website, redandfreckles.com, where you can keep up to date on all things red and freckly.
As always, you can follow us on Blue Sky, Threads, Instagram and Facebook, and not
Twitter.
And on those platforms, we use the handle @2damptrans on all the platforms except
Twitter.
And you can DM us if you have any questions or topics you'd like to discuss.
On any platform except
Twitter.
Don't forget to subscribe and rate us on Spotify, Apple, YouTube, wherever you listen to podcasts. We're on all the popular platforms now. Woohoo!
And even some of the unpopular ones, but not
Twitter. I do believe the account's still there.
It's still there, but we don't use it.
No. Apparently, if you've departed Twitter, as so many of us have, leave your account active. If you deactivate it, then someone else can grab your handle and do who knows what with it.
Is it a month you've got to visit every month to keep it active?
It is, yeah. Anyway, we do appreciate your feedback and support.
So until next time, remember, you are valid.
You are beautiful.
And you are transcending boundaries.
But not Twitter.
Nice.